Hello dudes, once again welcome to my YouTube channel. Today we will see another one nurse's letter. This is nurse to nurse letter. So we are going to write one referral letter to the nursing director in one community health center. So this letter is directed to the nursing director requesting a continued care for one post-operative patient. So let us see the writing task first. So every time you have to go to the writing task first, then you will come to know whether it is a known case or unknown case, to whom you are writing, and what is the content or what is the requirement you want to tell to the reader. And in some letter, some writing task, you can come to know what may be the recommendation paragraph. So these all relevant data you can find out from the writing task. So let us see the writing task for this particular letter. Given the patient's current situation, you need to write a formal letter to the nursing director, Jane Hurd of Southern Valley Community Transition Care Program, 64 Gladstone Road, Highgate Hill, QID 4101. Discuss the need of the patient's continuity of care at home. So in this writing task, we can come to know that we are writing a formal letter, referral letter to the nursing director, and our requirement is continuity of care at home, and this is not a known case later. So this much information we got it from the writing task. Now let us go to the main the content of the question paper. The nurse has given you are a nurse practitioner at the medical center Brisbane. Patient details are name Sydney Loten. So these are all the things we have to underline. Name, date of birth August 14, 1946, address, just we can read it. Actually it is no need because we can come to know that this is not a noun case. Then we will go to the social history. Retired professor, widow, we need it. An adopted son, 24 years old student, that one we need it. And husband died 2014. Lives with her son in a one-story house. Son is often unavailable to care for the patient due to school and work. So that one we have to underline. Oxygen readily accessible at home through nasal cannula at 2 to 4 liter as needed. Medical history, height and weight has given. We need to know that regarding the habits, alcohol and the smoking habits. Occasional alcoholic beverage drinker, 1 to 2 bottles of beer per week, but you have to see till 2019 only. 2019 January, 1 bottle of beer per week now. So we need only the current situation. So we need only 1 bottle of beer per week. In the same way, she is a smoker, 10 to 15 sticks per day for 35 years until 2018. So that one no need. But we need 5 e-cigarettes currently. No previous or surgical procedures. Diagnosed with the COPD, we should have COPD in 2010 and maintained on ipratropium bromide inhaler, 1 puff. There are more medications and the puff inhaler have given. So you can just have a look on it. In the same way, she has diabetic and she is diabetic and hypertensive since 2007 and 2008, and she is on metformin and glipizide, and for hypertension she is on losartan. Then we will come to the main point, that is the content of our present medical history paragraph. Here it is given, patient underwent routine colonoscopy, multiple polyps found. Admitted at a medical center, Brisbane on April 11, 2020. Colon polypectomy on April 13, 2020. So here they have given that patient has undergone colonoscopy on April 11, 2020. This is routine, in which multiple polyps have found, and she got admitted in the hospital. And after 2 days, she underwent colon polypectomy. So this is the starting points of our present medical paragraph. Then they have given some post-operative complications and how they have managed. Post-operative complications at a recovery room: experienced respiratory distress, arterial blood gas revealed, COVID-19 test negative, metabolic acidosis, and transferred to ICU and moved to regular ward on April 15, 2020. Patient is hooked to oxygen support at 3 to 5 liter per nasal prong as needed. Patient uncooperative at times and require encouragement to take medications. Difficulty in sitting and cannot walk around the room. Pain medication given, paracetamol, Endon, and laxative, Senna. Like that, many medications was there. In addition, she was on Foley's catheter. Now, with adult diaper due to incontinence. Stable vital signs and irregular wards. Still, patient is on oxygen. Moderate postoperative pain, wound with no exudates, and medical records has revealed. When you are reading the case note, in some case note you will have many nurses notes. Here you can see that many cases notes on postoperative day, then April 17, April 22, April 23, like that more things are there. So how you can make like a story and how you can concise the paragraph means you can have a look around everything, what all the medication has given and what all the important devices are, connected devices are there, and what all the assistive devices, and gradually whether there is any improvement in the ambulation. Everything you have to have a quick look, but you have to concise it simply, and it's like a short sentences, as in one or two sentences or three, maximum three sentences you can write. No need to write each and everything what are things it's have given in the case note. Like this only how to make the story. So how to make a story we can see it in the letter, but here you have to see only the important things. What all things I have underlined in reading, you can have a note. This is a thing, this is what is the things we are going to write in like a sentence in the letter. April 17, you can see that same, more or less same things only, but slowly progress will be there. Something like wound dressing, it's mentioned there, and patient encouraged for sitting, standing, and walking all around the rooms. And you can see that patient now walking with the walker, walk along the hospital corridor, but required still with oxygen. April 22, 2020, you can see that patient can walk with a cane now, but with the oxygen. Still requires adult diaper for incontinence. Eager to go home, discharge will be facilitated once oxygen availability at home is confirmed. Again, April 23, 22, 2020, this is a letter date. Patient is ready for discharge. Home medications and instructions given in the presence of her son. Okay, that one you have to note it out. In addition, need for transition care program is already explained. Then you can see that here actually they have mentioned it's like a nursing management, but you can see that the discharge plan and the recommendation is already given here. So this is what you have to keep it in your mind, and you have to take the thing what is exactly we have to write it in the last paragraph. Here, continued dressing changes at home, advised to monitor oxygen consumption, follow-up checkup scheduled on April 30, 2022. So in this letter, we have only three recommendation, that is continued dressing changes at home, advised to monitor oxygen consumption, and there is a note that checkup will be on April 30, 2020. So these are all the recommendations. So only three recommendations in this letter. Then writing task, I will read again. Given the patient's current situation, you need to write a formal letter to the nursing director, Jane Hall of Southern Valley Community Transition Care Program, and that is given. Discuss the need of the patient's continuity of care at home. So these are all the content of our writing task. So let us see how this content can be in a letter, how we can formulate a formal OET letter for this patient, Ms. Loten. So let us start our letter. So we'll start with the date 23 April 2020, the address, the nursing director, Jane Hall of Southern Valley Community Transition Care Program, 64 Gladstone Road, Highgate Hill, QID 4101. Next we will go to the salutation. Dear nurse, regarding Ms Sydney Loten, so Miss or Mrs. they didn't give actually, but the patient is widow, we can write Miss. Date of birth 14 August 1946. Then we will go to the introduction paragraph. So here the patient's recent present medical condition is she is recovering from colon polypectomy surgery, and the requirement is continued care or ongoing care or follow-up care. So we can write like this. I am writing to refer Ms Sydney Loten, who is recovering from colon polypectomy surgery. She requires continued care and is said to be discharged today. So this discharge status is optional. Either you can write or it's okay, fine if you didn't write also. Then we will go to the present medical paragraph. So this is a crucial point. You have to make a story from the starting until today. When you are writing the letter, how we can concise the paragraph we can see. So this letter actually it is somewhat big letter, the present medical paragraph will be somewhat big, so you can split into two. The first, we will start with the routine colonoscopy. So, we can write like this: Ms Loten. Hereafter, you should not write Ms Sydney Loten, only the surname. Ms Loten was admitted on 11 April 2020 following her routine colonoscopy, which confirmed colonoscopy procedure which confirmed multiple polyps. Thus, she has undergone the surgery on 13 April 2020. So here actually she did the colonoscopy procedure in 11 April 2020, in which it's found multiple polyps, for which she got admitted in the hospital and underwent the surgery on 13 April 2020. Then we will just write about the complications post-operatively, what all things is happened for her postoperatively, she had respiratory, it is had, but presently she don't have respiratory distress, but she is dependent upon oxygen. So we can write she had respiratory distress due to metabolic acidosis, for which she was treated in intensive care unit. Thereafter, she was moved to general ward. So here actually no need to mention the date, but we can just sum up what are the complication for which what we did. Okay. Then we can split the paragraph. We can write during hospitalization, Ms. Loten was managed with oxygen therapy, surgical site dressing, paracetamol 1 gram, Entone 2.5 milligram, and laxatives senna daily. So this is like sum up. No need to write like a day by day. You can write like gradually what all the things has happened, subsequently what all the changes has made, and currently what is her condition. So this is enough for this letter. So we just sum up that according to the priority. Here you have to think about the priority. We have to give importance for oxygen therapy because she had a respiratory problem. Then the surgical site dressing. Then you can write about the other medications. She was provided with the Foley's catheter, or else we can write she was connected with the Foley's catheter. But here already there is adult diaper also is there, so you can write she was provided with the Foley's catheter and adult diaper. Then we can write gradually regarding the mobilization. Gradually, she was encouraged to ambulate with a walker followed by a cane. So the first thing with a walker, then she was encouraged to use a cane. Then day by day, we no need to write what are the things, what are the things we encouraged. This is like a sum up. Then we can write currently she has made good progress, but requires oxygen therapy at home. Then we can write she was instructed regarding home medications in the presence of her son and explained the need for the transition care program. However, an ongoing care is essential for her until complete recovery. So this is like a conclusion paragraph, conclusion sentence in this present medical paragraph. What is the story? This is what I am telling regarding the story. Until now we wrote that patient has made good progress, she can walk now, and everything has improved, but there is something is lacking. Still she needs oxygen therapy. And in addition, upon discharge, she was instructed regarding the medication and the transition care program, everything. But still, she is in the recovery stage, not yet completely recovered. That's why we are writing, however, an ongoing care is essential for her until complete recovery. So this is clear that still she is not completely recovered. So we are requesting some help like ongoing care or follow-up care or continued care from your service until her complete recovery. So this is like a storytelling. Next, we will move to the social paragraph. Ms. Loten is a widow and lives with her adopted son, who is often unavailable to take care of her due to school and work. These all are personal histories. She drinks 1 bottle of beer. So I told you when I read the question, I presently what she is drinking and what she smokes, that is only the thing is needed. So she drinks 1 bottle of beer per week and smokes 5 e-cigarettes per day. Then we will go to the medical. She has had, because she has had, so this term how to be keep it in your mind. From 2010 it started and until now she has the problem. The same way, diabetic and hypertension, same way, it started from 2007 and 2008 respectively. Until now, she has the problem. So, and in the question paper, you can see that they mentioned already the year. So, if the year or the date from when the patient has the problem, you have to write she has had chronic obstructive pulmonary disease from 2010 and on prednisolone 40 mg and regular inhalers and puff. No need to write relevantly everything. This is like home medications only. So you can write these things just like a in short. In addition, she has had diabetes and hypertension from 2007 and 2008 respectively and on regular medication. So here also no need to write all medications because these all are home medications and regular medications. So we can just sum up in this way. Ms. Loten is a widow and lives with her adopted son who is often unavailable to take care her due to school and work. This is relevant data because the son could not take care of her properly, and other than son nobody is there. That's why an ongoing support is essential. So it is understood from there. She drinks 1 bottle of beer per week and smokes 5 e-cigarettes per day. She has had chronic obstructive pulmonary disease from 2010 and on prednisolone 40 mg and regular inhalers and puff. In addition, she has had diabetes and hypertension from 2007 and 2008 respectively and on regular medications. And we can write additionally one more sentence. She is on adult diaper. That one also we can just write. It's like semi-relevant data. Then we will move to the last conclusion paragraph, I mean the recommendation paragraph. Kindly provide follow-up care for Ms. Loten and monitor her oxygen consumption along with daily surgical site dressing. So actually here we have only 3 recommendations. That's the thing, we have to prioritize. Oxygen is the one priority. The next one is a surgical dressing. The last one should be the follow-up. So kindly provide follow-up care for Ms. Loten and monitor her oxygen consumption along with surgical site dressing. Please note, her follow-up checkup is scheduled on 30 April 2020. So these are the recommendation paragraph, and the conclusion will be, if you have any queries, please do contact me. Yours faithfully, registered nurse. Here the reader name is not given, so you can write faithfully, not sincerely. If the reader's name is given, you can write sincerely. So here, yours faithfully, registered nurse. I hope the letter is clear for you. So here actually this is challenging situation you will face in many of the letters. Sometimes there will be the present medical paragraph will be large, and sometimes the recommendation paragraph will have more content. This is the challenging situation you can face when you are writing the nurse to nurse letter, especially to the community health nurse. And but in this case there are only three recommendation sentences, so it is like small paragraph, but you can have the same problem in the present medical paragraph. So keep it in your mind, only this present medical paragraph can be written in two. The last recommendation paragraph could not be, and when you are writing, please keep it in your mind to make it like a story from the starting until now. What all the things happen, no need to write irrelevantly. According to the reader, you have to write in this letter. This one we are writing the letter to the community nurse, I mean the head of community nurse. So we have to write each and everything, but in a concise manner. And regarding the mobilization and the progress, we can concise and we can write, because as a reader, no need to know regarding everything. Just they have to know what other things happen, like a complication, how they managed, and what is presently and currently, what is the thing is going on, and what is the thing it's still we need, and what is the present status. So that is important thing. That's why I'm making a small, I mean that's why I'm writing a small conclusion at the end of the present medical paragraph. So the presentation will be good if you are writing in that way. And at the end of the letter, you can check whether your letter is correct or no. How we can see? You can see the recent present medical condition what you wrote. Here I wrote recovering from colon polypectomy surgery, and you can see whether your present medical paragraph is the expansion of that or no, because it should be relevant, I mean the expansion. So I wrote she's recovering from colon polypectomy surgery, and even in my present medical paragraph exactly I wrote the postoperative period, what all the things has happened and how we managed. And the same way my requirement is continued care. And in my recommendation paragraph, I wrote regarding the ongoing care and continued care only. So in this way, you can see, you can evaluate your letter by yourself whether it is correct or not. Nothing but your recent present medical condition should be that one should be expand in the present medical paragraph, and your requirement should expand in the recommendation paragraph. That means in the last paragraph. If it is like that, if it is correct, means you can think that your letter is correct. I mean, the organization should be correct, but the layout, I mean, what you mean in your letter, the content will be correct. So this is a small tip, and you can use it. And please make it like a concise manner, and you can see the word count. Just you can count from your introduction paragraph to your until your recommendation paragraph, the last line of your recommendation paragraph. Just you can count how many lines, and take any one of your line and count how many words are there, multiply both of it, and how much it will come. That is your word count of your letter. So it should be 180 to 200 as a standard, but in some way, in some time, maybe the letter will be very big, and they will give you the choice that maximum should be 210. And if it is a non-case letter, it's very small letter, especially if it is a non-case to a non-GP, or non-case to a physician. Of course the letter will be very small. So in this case, you can maximum make it like 170. It is acceptable range. 170 to 210, it's acceptable range, but please try to avoid to go beyond this 210 and 220. Sometimes for the community nurse letter, it will range until 300 if you are writing. At that time, you have to know how to concise the sentences. I mean, concise the content into small paragraph, but you have to include all relevant data. I hope it's clear for you. Please try to write in this same way if you like it. Okay, thank you for watching. We will see with another one interesting letter. Until then, bye.